We are looking at why your daily blood pressure pill might literally be leaving hidden clues in your body. Clues you've probably been completely missing. Because, listen, if you take these common meds, the story absolutely does not end the moment you swallow that pill. Not even close.
So ask yourself, have you been brushing off swollen ankles or maybe a nagging dry cough as just getting older? Or maybe you blame it on a bad night's sleep. When you glance at your daily pill organizer, you probably just see your standard morning routine. But what if those random, annoying symptoms are actually vital pieces of data? I mean, your body might literally be trying to warn you that your medication is affecting you in ways nobody really mapped out for you during your last, let's face it, probably very rushed doctor's appointment.
So here is our quick roadmap for today's explainer. 1. The blood pressure knowledge gap. 2. 3 drugs, different side effects. 3. Hidden traps in plain sight. 4. Dehydration and dizziness dangers. 5. Reading trends, not spikes. And 6. Becoming an empowered patient.
Section 1. The blood pressure knowledge gap.
You know, in those super quick medical appointments, you usually leave with a pill bottle, but really only half the story. The absolute crucial piece you're missing is that side effects are not some kind of personal weakness. They're data. Look at Gloria, for example. She took her meds exactly as prescribed, and her numbers looked fantastic on paper. But about 3 months in, her shoes stopped fitting, her ankles were puffy, and her legs felt incredibly heavy by bedtime. She was literally terrified her heart was failing. But in reality, it was just data. Her body was simply showing her how her specific medication worked. She just didn't have the context to translate what her body was saying.
Section 2. 3 drugs, different side effects. Now, these medications are absolutely not interchangeable. They aren't just the exact same pill wearing different brand labels. Your specific drug class creates a very specific pattern of side effects. Take amlodipine, for instance. It's a calcium channel blocker. It relaxes your blood vessels, which, you guessed it, often leads to ankle swelling. Then there's lisinopril, an ACE inhibitor, notoriously famous for causing this persistent, dry, scratchy cough. And losartan is an ARB, which can cause potassium shifts and dizziness. So same end goal, but entirely different pathways to get there. And if you don't know your drug's class, there is no way you're going to recognize its pattern.
Let's talk about Arthur and Helen. Arthur just figured his swollen ankles were a normal part of getting older. He started sleeping with his legs propped up on pillows, and he never once connected it to his amlodipine. And Helen? She spent months buying throat lozenges and swapping out air filters because of this scratchy cough keeping her up at night. What nobody mentioned to her was that a lisinopril cough can actually show up months late. Because they didn't know these specific patterns, they both just suffered, completely silently and completely unnecessarily.
Now, I want to make a really clear distinction here. We have to separate a harmless, annoying dry cough from angioedema, which is an absolute drop-everything emergency. Angioedema is this rare but extremely life-threatening swelling of the lips, tongue, face, or throat. It's most classically associated with ACE inhibitors like lisinopril. So if you just have a little tickle in your throat, don't panic. But if your tongue or your throat actually starts swelling, that is not a let's call the doctor on Monday kind of situation. That requires immediate emergency care right then and there.
Moving on to Section 3. Hidden traps in plain sight. So everyday items sitting right there in your grocery store can actually secretly clash with your prescriptions. Take Robert's story. He probably switched to a heart-healthy salt substitute, totally unaware that it simply replaced sodium with potassium. And since his losartan already raises potassium levels naturally, he inadvertently created this dangerous spike that messed with his heart rhythm. Or consider Carol. She took some weekend over-the-counter ibuprofen for her arthritis. Well, combine that with her lisinopril and a water pill, and she unintentionally whipped up a perfect storm for kidney injury. You see, over-the-counter definitely does not always mean safe. Then we have what happened to Sharon. When you start drugs like lisinopril or losartan, a minor shift in your kidney numbers, which is exactly what Sharon had, can actually just mean the drug is tweaking pressure dynamics to protect your kidneys over the long haul. But she saw that red number in our online patient portal and was literally one click away from throwing her meds in the trash out of sheer panic. This is exactly why intelligent interpretation with your doctor is so vital. A small lab shift doesn't always equal kidney damage.
Section 4. Dehydration and dizziness dangers.
Okay, this is a massively overlooked trap that completely rewrites all the rules. Losing fluids. Frank faithfully took his losartan right through a terrible stomach bug. He was super proud of himself for never missing a dose, right? But because he was completely depleted of fluids from being sick, the whole internal environment of his body had shifted. So that exact same dose acted entirely differently. His blood pressure just completely bottomed out and he nearly collapsed. When you lose fluids, the rules change. You absolutely need a sick day plan with your doctor, not just blind obedience to the instructions on the pill bottle.
And speaking of collapsing, if you take amlodipine, like Joseph, who practically fainted in his dark bathroom one night, you really have to follow these steps. Your body needs a minute to adapt to its new, lower blood pressure. It's simple. Sit up slowly, wait on the edge of the bed for a moment, and stand up carefully while holding on to something stable. A few seconds of dizziness might just be proof the medication is doing its job, but ignoring that dizziness can easily lead to a devastating fall.
Section 5. Reading trends, not spikes.
Look, a single number on a monitor is just a snapshot in time. Let's talk about the wrong way to monitor first. We've all seen this. Panic checking your pressure multiple times after seeing a stressful news headline or getting a headache, and treating that one single reading as a final verdict. Diane did exactly this, and all it gave her was a notebook full of numbers and a whole lot of anxiety. The right way? Test consistently at the exact same times each day, after resting quietly for a bit, and strictly look at the long-term patterns. The chaos is usually in how we test, not the medicine itself.
And please, remember Martin's double-dose mistake. If you miss a dose, you absolutely cannot just double up later out of panic. Martin took an extra pill after getting a high reading because he was terrified of having a stroke overnight. The result? He ended up feeling completely washed out and dizzy the entire next day. Guys, these are long-game medications. They are not quick-fix rescue pills for random temporary spikes. Consistency is the secret sauce that turns a prescription into a genuinely stable treatment plan.
Finally, Section 6. Becoming an empowered patient.
Teresa had incredibly beautiful numbers on paper with her lisinopril. Her doctor was thrilled. But in reality, she was suffering silently with this miserable, persistent cough and getting absolutely terrible sleep, all because she just assumed it was a cross she had to bear. This right here is exactly how patients end up abandoning their meds. They resent taking the pill, they start skipping it, they stop altogether, and boom, their blood pressure shoots right back up. Real effective care means the actual human being matters just as much as the pressure reading on the chart.
So let's look at your empowered action plan. If you're on amlodipine, keep an eye out for ankle swelling, flushing, and heavy-feeling legs. On losartan, watch for that persistent dry cough, or heaven forbid, dangerous lip and throat swelling. For losartan, monitor for dizziness, weird muscle cramps, or potassium shifts. And the rule for all of them, report unexplained patterns early. Your job isn't to play doctor and diagnose yourself. Your job is to notice the unique patterns of your specific class of drug and speak up right away. Do not wait until you're absolutely certain.
Silence is not strength here. Silence is risk. I mean, that quote just perfectly hits the nail on the head for this whole explainer. Being a good patient doesn't mean you just smile, nod, and never complain. It means flat out refusing to suffer in the dark. It means paying close attention and actually understanding the incredibly powerful medications you're putting into your body every single day.
So I'm going to leave you with this final thought. Are you ready to stop brushing things off and actually turn your symptoms into data? Seriously, go check your medicine cabinet tonight. Know your drug's exact class, understand your specific patterns, and use this knowledge to step out of that fog of half information. It is time to become a powerful, vocal advocate for your own long-term health. Because really, what's stopping you from taking that control back today?